Hello, welcome to An Hour to Give. I'm Sam Laprade. Today is all about the Distress Centre of Ottawa and Region, and I know you know about them, but we're going to take a bit of a deeper dive today and find out ways that maybe you can help and ways that you can engage. We're starting off today with one of my favorite people, and that is Dr. Gail Beck. She's interim psychiatrist in chief and Chief of Staff at the Royal. Hello, Dr. Beck.
Hi, Sam. It's so nice to see you again.
I'm so happy because we've had lots of chats, but normally on radio.
Yes.
So I get to see you today, which is the thrill.
Yes. Oh, it's great.
And your role at the Royal, and I've, as you know, followed your career. I have so much admiration for you. Give us a sense of what your role is. What are you in charge of?
So I'll just start maybe with my favorite role at the Royal.
Sure.
And that is that I'm the clinical director, the permanent clinical director of the youth program for a few more years. But for the last 19 months, I've been the interim chief of staff and psychiatrist in chief. And so in that role, I really have a responsibility to the physicians in the hospital to ensure that they can do their work well. It's been an honor, actually, to represent my colleagues in that way.
And they feel that way about you, by the way.
Well,
lots of respect.
Yes. As I said, it's been a great honor to represent them and to work for them.
Yeah. So when we think about the Distress Centre of Ottawa and Region, and we think about your role at the Royal, how do those two things come together for you?
Well, the Distress Centre, like the Children's Hospital, like the Ottawa Hospital, like Youth Services Bureau, like Canadian Mental Health Association, the Ottawa, all of those are partners in mental health in the region. And so we want to be working with them as effectively as we can at the Royal. And the Distress Centre plays that very important role when people don't know who else to call, because hospitals aren't open 24/7, except in an emergency room. And people are waiting longer in emergency rooms. And sometimes at a Distress Centre, they manage difficult circumstances and help people figure out what they should do in a very critical moment for them. Mm-hmm. And they're an essential part of mental health services.
Mm-hmm. I love that you refer to them as a partner. I love that because I think it's really nobody can work in isolation anymore.
No.
Yeah.
No, we shouldn't be working in isolation, but part of that team needs to be broader because you just never know who someone is going to feel comfortable speaking with. And when, especially at times, when you don't want to say, this is who I am, I just wanted to chat, I have this problem and I want to know if it's serious, sometimes the anonymity of a distress center can help. Mm-hmm. They can also help when you do need more practical solutions to what's going on. If somebody is calling in and they're at risk of hurting themselves, then absolutely the distress center will engage who they need to engage. Mm-hmm. And so it is like all mental health partners, like all partners in healthcare, there's a flexibility needed, and the Distress Centre has shown that it can provide that. And
as the show continues today, we're going to talk about the fact that they're also a hub for incredible resources as well, and you know the volunteer component. I mean, they're just it's wonderful, and I've gotten to know them over the years. I think it's like an onion. Every time I talk to someone at the Distress Centre, I learn something else. Right?
I was about a year ago. I was sitting with a social worker trying to figure out what kind of resources there would be for a particular youth in the office, and she said, "Oh, give me a second," and she called the Distress Centre, and I'm like, "What are you doing?" Yeah. And she said, "Oh no, they'll know what resource this kid needs." So when you think about that, I think that tells you that, you know, the Distress Centre has an enviable Rolodex. Do we still have Rolodexes? Whatever we have these days.
I know what you're talking about. Yeah. Yeah, that's amazing. Can we have a really honest talk about mental health?
Yes.
So how bad is it in our community right now?
Well, we don't have nearly the resources that we need to look after the people in mental health distress in our community. And I don't know whether or not governments and funders see that the way they need to. Mm-hmm. People are working flat out. You know, emergency rooms across the city are inundated with people in mental health crises. We're sent on a daily basis in this particular role a census of who's in beds. And some of our hospitals are not only full every day, but are full and have people waiting to be admitted. On top of that, there are wait lists for people just to see a counselor, a therapist, a psychiatrist, and even more, the front line for mental health in any community has been family physicians for years, and we know that 150,000 people in Ottawa are without a family physician. So they are missing completely the front line on mental health care.
I knew you'd give it to us straight. I really, I mean, I think back to, and I look back now, how naive I was, is before the pandemic, we talked about mental health being a crisis. And then the pandemic hits. And I remember speaking to you numerous times through the pandemic, talking about young people, talking about, my daughter, for instance. We go into the pandemic. She's 12 years old. We come out of the pandemic. She's just turning 15. There's 3 years of those fundamental youth years where she's supposed to be at soccer tournaments and sleepovers.
And during that time, she's moved from grade 7 into high school. And depending on where we were at in the pandemic at the moment she made this transition, she may not even have been able to get into the building because a lot of schools didn't actually, and they were opening and closing. So you'd wake up in the morning, am I in school? Am I not in school? Am I online? Am I in Google Classroom? Those things were also very hard on people. But for me, for that young group of people who, as much as they depend on their parents, they also need to be with each other. And I have, because I worked in a school, in a specialized classroom at that time, and I remember you'd walk in the morning and you'd see these people responsibly distancing with their masks on and just sort of waving, all excited to see each other. And I think that young people were some of the heroes of our pandemic, and they didn't get enough credit for the fact that they just managed it. They had to distance. Were they in school? Were they not? What was happening with college, university? What happens as you move to grade 9? And they, we didn't hear a lot of concerns about them, but their stress built up in that time, and we are seeing the impact of that now.
Drive-by birthday party is no way to celebrate, right?
No,
I mean,
it's
those
not.
are...
Drive-by graduation.
Exactly. We think about those things. It just seems so ridiculous now to even say it, but the reality is that that's how we lived.
I remember at that time I was on the board at Algonquin, and we had these virtual convocations. So, and the Algonquin convocations are marvelous, right? You're in the Canadian Tire Centre. You can invite anybody you want. There's cheering. It's raucous. And all of a sudden, you're not there anymore. You're watching it on television.
Yeah. We know that there's been recently 988 added to, we have the 911, we've got 211, we've got 988. Talk to me a little bit about how important it is to have this fundamental number that people can call.
I think the main thing about it is that if you think about our regular crisis lines, and I know that you're projecting the numbers, the local numbers for crisis lines, when you need that, imagine trying to find that in a moment. The idea that you have a number, and they call it a suicide hotline, I believe, but it's not just around that, right? It's also just mental health crises. To have a number that you remember to call, and it's easy to remember, just makes it easier to access services that are already available. I know the emergence of that line, while it's positive, we were a bit worried in a city as well supplied with lines like this, as Ottawa is, to make sure everything connects where there already was knowledge and there was, they have the resources. But there's no doubt having a number like 988 that it's easy to remember, that makes it easier to access in a moment where you just need help now.
Absolutely. And when we think about the number of people in this city that are struggling, and some of it has started with domestic violence, some of it has started with poverty, some of it has started with there's new Canadians coming, not knowing resources. There's people that are maxed and stressed for financial stress. Where do we start in this city to ensure that everyone does feel supported?
I think that one of the things that every single person can do just on an individual level is a personal contact thing, right? Like your neighbors. I think it needs to be said in an era when there's so much incivility, could people just be nice?
I know. That's
Right?
how I feel.
And I think that one of the reasons that helplines and things like this are so important is that at least you know you're going to call and speak with someone who's going to try to be helpful and who sounds supportive. Because I think that there are oftentimes, sometimes, I'll call a family doctor's office and you don't get a person. And the answering machine says we don't take messages. And they do that because they're absolutely overwhelmed. But at the same time, it's so hard to hear that when you're worried about your child or your mother or those kinds of things.
Yeah, there's so much going on. What's next for mental health in this city? We know that there was some incredible work being done during the pandemic, but in terms of mental health, are there any initiatives? You think about the partnership with the Distress Centre. Are there any other partnerships or anything else you want to sort of share in terms of strides that we're making forward?
Well, I think that we're in an interesting era at the Royal. There's a new CEO. We have a new chief of staff starting next month. And we're looking at how we manage mental health with our partners in the region. I think the other thing that we need to develop, in the child system where I work, I think that one call, one click, right? That you call into and it works to get you the referral you need. Access MHA isn't quite there yet, and it needs to be. And I think that families will find that once we get Access MHA where it needs to be in the region, that there'll be a lot more support. In Ottawa, we must begin to urge governments to do what they need to do to ensure good primary care. More family physicians, more family teams, health teams, to bring back the infrastructure of healthcare, because it's hard in my position as a specialist trying to work when somebody doesn't have a family doctor. And if I see somebody who's got a fever, well, I've kind of got it.
Right.
But it's a long time since I looked after somebody with heart disease or type 1 diabetes or some of the common illnesses of childhood, and they don't want me doing it. They shouldn't want me doing it.
Such a good perspective. I could spend all day with you.
I could spend a lot of time with you too. Thank you very much for the work you're doing.
Thank you very much, and you've just made such an impact in our community, and it's not lost on me how hard you work. Thank you.
And you too.
Interim psychiatrist at chief, and of course interim chief of staff at the Royal, the wonderful Dr. Gail Beck. When we come back, Catherine Leroux is going to be here from the Distress Centre of Ottawa and Region. Stay with us on An Hour to Give. And we are back on An Hour to Give. We're talking all about the Distress Centre of Ottawa and Region today. And I've known this lady for a very long time. I'm so excited she's here. Catherine Leroux is here today. Hello.
Hi, Sam. So great to see you again and so great to be here.
I love this title for you. Manager of Marketing and Communications for the Distress Centre of Ottawa and Region. And I know people are watching their TV and listening right now going, I know Catherine Leroux from 1,000 other things, but this job is so suited for you. Are you having a great time?
I'm having so much fun, but I'm also very, very aware of the severity of the situation and the issues. But no, this job move for me was one where I wanted to have some impact, some positive impact on the community. And I don't know, I mean, there are many organizations that do, but the Distress Centre kind of covers all those bases.
Yeah, you're doing a great job.
Thanks.
So let's step back and give the history of the Distress Centre, because I think often people hear about it maybe only in times of crisis, but give a bit of history.
Yeah, and I did want to point that out because, I was at an event the other day where I mentioned the Distress Centre and someone said, oh, what's that? So it's not that everybody knows who we are. Certainly, we've been around since 1969.
Wow.
And we have been taking calls or providing support 24 hours a day since 1969. The business, the organization has changed dramatically since then, as you can appreciate. I mean, certainly call volume, number one, but today we actually answer our own distress line, the mental health crisis line that's part of the hospital system. We provide support for Nunavut to Nunavik and everywhere from Cornwall to Pembroke and even into parts of Outaouais. So it's really changed a lot. And of course, as I said, volumes just go up every year.
And you rely on incredible volunteers. We're going to meet a couple in a few minutes, but that reliance on volunteers that are heavily trained and also making sure that those volunteers are supported is such a big part of the work.
Absolutely. We couldn't do it without the volunteers, you know. Right now, I believe we have about 200. That's kind of the number we try to stay at. They do receive significant training. It's a 60-hour training program. It also includes a nationally recognized certification in suicide intervention called ASSIST, and that's a 2-day hard-on, training period for all of our volunteers. And then we have support systems within Distress Centre, of course, you know, escalation specialists, people who can step in and assist when sometimes things may not be going the way they should be. So,
and the pandemic, we spoke a lot during the pandemic as well to the Distress Centre and had conversations with yourself as well in recent years, and really talking about the options now that are available for people reaching out. You've opened up lots of options.
We have, and you were talking to Dr. Gail Beck earlier, and by the way, loved her segment. She hits every mark for me, and you know, I want to talk about a couple of things that she said. But yes, we of course have our main distress line. We have mental health, and then in November 30th we launched 988 across the country, and this is an initiative that's actually been in the making for a long time. This didn't just happen. It's been coming along for a very long period of time and badly needed. So we handle now 988 calls, not only for the Ottawa region, but we also get overflow calls from across the country. And that's one of the beauties of this system. So that previously there was a line called Talk Suicide. And I did want to mention that while suicide ideation, suicide intervention is its primary purpose, it's also there to help people who are experiencing, you know, significant mental health crisis. So there's no wrong door. You can call any of the numbers that are available to you, and the system will work to get you to the right place. But no, that's been just an incredible addition to our support system here in Ottawa and indeed across the country.
Now we call, we talk, and you listen. But I want to ask you a question. What do you actually need from the community? What do you need from us?
There are really three primary things. I mean, first of all, call. If you're not calling for yourself and you're concerned about a loved one, call. If you know someone who's struggling, tell them to call. So that's first and foremost, is that very, very important message. And as Dr. Beck said, you know, it can be anonymous. We don't, you know, you can not give us your name. We're really just there to help you deal with whatever you're dealing with. The other thing, of course, is to volunteer. And while we have an incredible group of dedicated volunteers, it does change every year, and we're always, especially with the increase in call volumes. Last year we answered 55,000 phone calls. So we're always looking for volunteers, and then of course donate. And I know that Melanie's going to talk a little bit about that later. We are a not-for-profit organization. We do receive funding from our partners, but the need always far outstrips the actual availability of funding. So.
No, it's so important, and when I think about the opportunity for 24/7. 365 days, like on Christmas, on during Hanukkah. I mean, it doesn't matter when it is, people are available to talk. And I think that's the part that probably people are a bit surprised at, because our world is so 8 to 4, 9 to 5.
Right. And also with 988, they can also text. We don't currently do text. We did run a pilot during the pandemic, which was very helpful. And we're now trying to figure out how can we add that going forward to our regular service offerings.
And what would you say to somebody that is a bit nervous to call because they're thinking, geez, there's so many people that have got problems going on. My problem really probably isn't as big as everybody else's problem. What would you say to them?
I would say to them something that we actually put in print, and it's on our website. If it's a crisis to you, it's a crisis to us. And that's really all that matters. If it's something that's upsetting you, bothering you, you're concerned about, and again, maybe not just for you, but for someone you love, someone you care about, then absolutely, non-judgmental, no one is going to judge anyone who calls. It's simply going to be, okay, what do you need? Are you looking for resources? As Dr. Beck said, we have thousands of resources at our disposal, and we can help you navigate the very complex mental health support systems that are there. And again, Dr. Beck mentioned that we do work in concert. We do. We work very closely with the hospitals. We also support paramedic calls for people who are experiencing mental health crisis. And that would mean that if you are having an issue, you've called 911, they've identified that it is mental health derived, your situation, they will then call us and put the caller on the line with us while they wait for the ambulance to arrive. So, that's an example of a good partnership within the continuum of mental health care in the city.
I think what really surprised me a number of years ago when I was starting to learn about the Distress Centre of Ottawa Region is that resources that we spoke about, that you're really this hub. And when I think about all of the pressures on families right now, whether it be trying to get kids into sports and the bank account just isn't making it happen, that's a big pressure on families. What we're talking about in terms of groceries and mortgage rates, I mean, all of that, if you've got some underlying mental health issues, that can exacerbate that, and all of a sudden the day becomes really challenging.
It does, and Sam, the important thing is that you could call simply because you're having a relationship challenge. We talk to people all the time, people who are isolated, and just, loneliness throughout North America has been identified as a pandemic. It's a crisis. The number of people, and especially during and after the pandemic. I think during the pandemic, actually, people made a great effort to reach out and to connect. I think we've kind of lost that a little bit. So as Dr. Beck said, just be nice. Just be nice and talk to your neighbors and talk to people, because loneliness and isolation is probably one of the number one factors that drive people to call us. And then the other one is just helping people figure out, and that's really what we do. We don't tell you what to do. We help you find solutions that you're comfortable with, and provide you help you build a plan to kind of move you from where you are into a better space.
Yeah, fantastic. And I just want to put a point on as well, we're going to be speaking with volunteers, as I mentioned, is that you're always ensuring the volunteers are feeling supported in that work. The last thing we want is a volunteer to not feel well, stepping into those roles. So talk to me a little bit about how we ensure their mental health.
Yeah, first of all, we stress it tremendously during the training process. We also, our trainers are very good at identifying if this role might be a little too challenging. So I would say that to people as well. If you're considering a volunteer position, come and join one of the first info session that we give when you join up as a volunteer, and we'll help you figure out if it's right for you. But over and above that, yes, we have leaders on call 24/7. So if you're having a challenge with with a call, if you've had a call and the call is over and you're just not feeling good about it, or you're quite upset about it, you call either one of our escalation specialists. I think Kaylee's coming on later. She's a quality assurance. She supports our volunteers in the call center. And then, of course, the 24/7 leaders on call to provide that support. And we always say, get off a call, you don't feel like you can take the next one, don't.
Right.
Don't.
Very, very, very smart. We talked about volunteering and donating. Where are we sending people, Catherine?
To the website, dcottawa.on.ca. There's an entire section on volunteering, a section on donating, fundraising, and then, of course, more information about mental health supports and different crisis lines and what they do.
My vintage, so I'll take you back to, I was born in 1971. I'll tell you, I really don't think that I heard the term mental health until I was into my 20s, truthfully.
No, absolutely. And Sam, I had a brother who committed suicide in 1986.
So sorry.
And, it was a really difficult time, but it was more difficult because nobody would talk about it. And so at that time, it simply wasn't, it simply wasn't mentioned, and it wasn't, except amongst very close family members. But outside of that, no one talked. Today, people talk about it, and that's what we need. We need to continue the conversation. We need to make sure that everybody is continuing the conversation.
100%. Once again, inspiring, and I know we've inspired people today to give, to donate, and most importantly, as you indicated, to call. So thank you so much. Catherine LaRue from the Distress Centre of Ottawa and Region. When we come back, we're going to meet some of these wonderful volunteers. You don't want to go anywhere. Stay with us on An Hour to Give. If you're wondering who takes those 55,000 calls at the Distress Centre of Ottawa and Region, it is volunteers, and two of them are joining me now. I'd like to welcome Kaylee Whittam to the show today and Donna Boyce. Hello to you both.
Hi.
Hi.
Thanks for being here. And Kaylee, you've been with the Distress Centre of Ottawa and Region for a little bit. Tell me a little bit about your journey.
Yeah, so I've been there, I guess, about a year now. I actually did my student placement there, so I had a bit of a unique experience. So I did the training, and then my placement was a 12-week placement and 300 hours. So I had a lot of time on the lines in a very short amount of time. I had to learn very quickly.
Wow,
Yeah.
that's impressive. That's a lot of time, for sure.
Yeah.
And you're a recent addition and a welcomed addition to the team. Donna, talk to me a little bit about how you got involved.
So I'm a big believer in volunteering, and I've done various different types of volunteer throughout my life. And mental health is a huge concern for me. Many generations of mental health challenges in my family. And when I found out that this was an opportunity, I absolutely jumped on it. I hope that it's something that my family members use, and I hope that it's something that everybody takes advantage of, because it's an amazing, amazing resource.
It is. It's wonderful, and the opportunity today to talk to each of you and get your experience. 300 hours and just what you would hear from the community. Give us a sense of what, and obviously we're not using anyone's name, and confidentiality is number one, but give us a sense. What are some of the concerns of the community right now?
You know, we get calls from every kind of person, different ages. You know, some are employed, some are unemployed, some people have lots of money, some people are lower income. Of course, with the economy the way it is right now, that has been a major concern. People are struggling to just afford their basic necessities. That is certainly a big one right now. We receive calls from people who are going through psychosis, depression, all kinds of different things. It's kind of difficult to pinpoint just a few. You never know what you're going to get when you pick up the phone. Mm-hmm. Yeah.
And give us a sense, when you sort of started this journey, the training, were you impressed by the level of training and the intensity?
Absolutely. The training is incredible. The trainers were amazing, very informative, very experienced. When I was going through it, it was very long, and I sort of half wished it was not as long, and now I wish I had more training now that I'm on the lines, but it was absolutely incredible.
And your role has changed. So talk to me a little bit about, coming in, that 12-week placement. Where are we today, Kaylee?
Yeah, so I was actually really nervous starting my placement because I was a little unsure about crisis intervention and what that looked like, and I fell in love with it. The kinds of relationships that we build with our callers are just incredible, and so I really tried to find a way to stick around longer. And so I started with a few little projects here and there I was helping Catherine with, and then I was able to find a bigger role. So now I'm a quality assurance specialist, and essentially what I do now is, so I do take calls still. I take emergency shift cancellations, and I take overflow calls if it's needed, but primarily I'm an on-site support support for the responders. I also have a counterpart as well, Abdullah. We are in the center to support the responders from 7 a.m. to 9 p.m. And we give them we help them with any questions they have. We give them guidance. We're also part of the crisis intervention team. So if someone's in imminent risk and we need to contact emergency services to ensure their safety, then we do that. And a bunch of administrative stuff, and we do all sorts of things. So it's been an incredible opportunity for me, and I absolutely love what I do.
You can tell. You can tell the passion. How reassuring is it for you to have Kaylee and Abdullah there to rely on if there's a call and you think I need some support here?
I don't think we could do it without the support of all of the leaders and the quality assurance team and everybody. I just wish every organization treated people as well as the Distress Center treats all of the volunteers. They are absolutely amazing. And I remember my first crisis where I had to reach out to a leader for support. And I was so grateful that they were there to help in that situation. And very surprised in a pleasant way when afterwards they asked me if I was okay and did I need support and what did I need in order to sort of get over that difficult call. And no, it's phenomenal, absolutely phenomenal.
Mm-hmm. It's so important. I mean, we spoke about that earlier with Catherine LaRue. I really feel like this is something that I want the community to know, that the people that are supporting them are well supported. How important is that for you?
Oh, it is. It's invaluable, really. It can be very emotionally draining, to take calls. Obviously, it depends on the day and the calls that you're getting, but it can be really challenging sometimes to navigate your own feelings about a call that you've had. And so, to have the support of the staff and the leaders, it's so important to be able to know how to take care of yourself and take a step back if you need it. And of course, we encourage that. You have to take care of your own health, safety, well-being before you can help someone else. You can't pour from an empty cup. Yeah. Right.
I'm picturing that mask that comes down from the plane too, right? You got to put your own mask on first. That's the visual that comes to my mind. But yeah, so important. Do you tell your friends and family? I mean, I guess they're going to find out today. But do you tell your friends and family that this is a role that you have in the community?
Absolutely, I do. I was very excited about it, and everybody said that's going to be so hard. That's going to be so difficult. Are you sure? And I just thought of the journey that my children have been through, and I was like, absolutely sure.
Yeah, that's okay. And I think too, when we think about all of the, the crisis, I think people think Ottawa, they think government town, they think fat cat city in terms of, of the economics in this town, because we can be sometimes protected from some of the other industry things that happen. But the reality is, Ottawa has, I'm heartbroken to say this, a huge homeless population now. People that are, living couch surfing, people that are not in precarious situations. We think about human trafficking, we think about poverty. I mean, there's just so much happening in this city. And I think people think not in Ottawa. But the reality is we're a city of 1 million people and we're growing, and the needs are only going to get deeper. Do you feel that, this is something that the Distress Center's there for everybody, and you also need to grow as an organization, and that's why we're looking for donations and more volunteers, right?
Yeah, absolutely. That is actually something that we hear about all the time on the lines, and obviously we have limits to what we can do, but we're always there to listen and to connect people to community supports that they may not be aware of, right? And it's not even just in Ottawa as well. Like Catherine was mentioning, that we take calls from Renfrew County, from other areas, and it's a huge problem in those rural areas as well. And where there's less support, that's where it's a real challenge. So really kind of seeing how we can expand and help these people, it's really important. And so, like you said, those donations are very important, and also the volunteers as well. Like, we need as much help as we can get to support all of these people in our communities.
And because, Donna, you're one of those voices that are going to be picking up those calls, reassure someone today that thinks, I'm going to call the distress center for the very first time.
Absolutely, absolutely. Pick up the phone and call us. It doesn't matter what the issue is. You don't have to have a mental illness or be diagnosed with a mental illness. A lot of the calls are, I'm in crisis, or I just need somebody to listen to me, to validate me. It's all good, and we are there for anything that anybody in the community needs. Please reach out.
What's your journey ahead? Do you think that you've got this incredible opportunity? Where do you see yourself in your role?
That's a good question. I'm not entirely sure. What I do know is that I love what I do, and I want to stick around and make a difference with our volunteers and with the people in our community. So really, any opportunity that presents itself to continue doing that, I will take.
I don't know about you, but I feel a lot of hope when I see people like Haley. This age group, I'm kind of speaking about myself right now, but this age group, taking, because I just said to Catherine, I didn't talk about mental health at your age. We didn't, because it was really taboo. And to sit at this table today with the two of you, and you're so engaged and taking those calls and hearing from people, from a frontline perspective, what's going on, and it could be $1 million house in Manotick, and it could be a rooming house in Sandy Hill, right? And I think that's a really important piece that this is happening in all areas of our community. Would you agree?
Absolutely, absolutely. It is, it's essential, and it impacts everybody. There's nobody that doesn't need a lifeline or a call a friend at some point, and we can be that for you always.
For sure. And we talked about donations. We talked about volunteering. We've got about 200 volunteers, I understand. But I would think it would be quite a fluid piece. Somebody might be moving or going on to something else, or they might have said, I've done my time. They might be there for a couple of years. Inspire us to volunteer, Kaylee.
Oh, it's really just an incredible place to be. It's a very relaxed environment. The staff, everyone is super supportive. But where you'll feel like you're making the biggest impact is when you're taking the calls, and it's just amazing. I can't say enough about it. Even when someone calls with a paper cut, and they're just having a crummy day, you can sense the change throughout the call, the tone by the end of the call, their mood, it shifts, and that feels incredible. It's an amazing feeling, and I really can't say enough.
It's amazing. Thank you both so much. Donna Boyce, thank you so much for joining us today, and of course, Kaylee Whittam, thank you. Appreciate their time very much today, talking about how important the volunteers are for the Distress Centre of Ottawa and Region. When we come back, we're going to inspire you because there's some fundraising going on. Stay with us on An Hour to Give. I have a little bit of homework for you. I'd like you to visit dcottawa.on.ca to learn more about the Distress Centre of Ottawa and Region. We've talked about lots of different aspects today. We've talked about the big need, of course, in the community. We've talked about the fact that the Distress Centre took 55,000 calls last year. And how is all this funded? Well, much of it relies on the generosity of our community. And I am so excited to welcome Melanie Grasshernan to the show today. She is with Ottawa's Young Construction Workers. Hello, how are you?
Good, how are you?
I'm fantastic. So talk to me a little bit about your day job.
So I work in the construction industry for my family's construction company, Waterton Construction, and I'm a project manager, so I run commercial construction projects during the day. And then I volunteer for the Ottawa Young Construction Leaders with the Ottawa Construction Association.
It's incredible. So you've got an incredible organization that really is trying to make a difference.
Yes.
And my very first comment when we set up the show, they said you were coming on, and I thought, what does construction have to do with mental health? And boy, did I learn a lot. So talk to me a little bit about the prevalence of mental health with construction workers and construction leaders.
So I read on StatsCan that 1/3 of construction workers in Canada have reported having mental health issues. And that's just what's reported. I can only imagine how many there really are. And it is a huge issue that we all deal with and that we all have. So it's a great way to give back to something that can help our community and help our members.
I love it. I mean, you think about I would assume, so correct me if I'm wrong, the pressures of the construction timelines, and you're dealing with weather delays and maybe permit delays, and, you know, the speed that all this housing, they're wanting all this housing to be erected immediately. I mean, all of that pressure, and the number of people in the trades is not as what it used to be, right? So there's lots going on there, right?
Always. There's pressure from all aspects in every role in our industry. And it's fun and it's great and you get to see what you did at the end of the day, but there's definitely a lot of stress in it. And it takes a lot to bring a project to life.
Yeah, for sure. It takes a lot of commitment. And when I think about the Distress Centre of Ottawa Region, I love the fact that it's 24/7. So, you know, a young construction worker, any construction worker, anybody in the community can reach out 24/7. How important is it for you that the Distress Centre is 365 there every minute of the day?
It's very important. It fills a gap in our health system that we do have at off hours and people working different shifts. They can reach out and get help anytime and be led in the right direction without a cost associated for them.
I love the fact, Melanie, that you know, that you have this connection to mental health in your sector, but you didn't just sort of talk about it. You took some action. July 11th is the big day. Tell us what you're doing.
Yeah, so July 11th, we're having a golf tournament at Greensmere Country Club for the Ottawa Young Construction Leaders, and we chose the Distress Centre of Ottawa as our charity of choice. We'll have 288 golfers that day.
Wow.
And they're all firms that are members of the Ottawa Construction Association.
I love that. I love that. So tell us what the day's going to look like.
So we have a lunch at 11 and a shotgun start at noon. And then we have different holes that will be staffed by different sponsors and different activities. And we have a dinner that evening as well, and a 50-50 and some prizes to be given out.
That's amazing. So it's really a day for people to come together. And how open have you been with all of these great golfers that that the day is all about the Distress Centre? So
it's on all of our promotions. And every year we choose a charity to support. And we thought this was a really important one this year.
And talk to me a little bit about why is there a separate group sort of for young construction leaders?
So we're a group under 40. And we provide networking opportunities for our members to come together and build relationships. And then also we have an event every month, and we choose a different charity every month to give back to our community, because it's important to us to support Ottawa and the community here.
It's so important. And when I think about all of the golf tournaments in town, the ones that I think people remember the most are the ones that not only did they have fun on the green, but they had and raised a lot of green for for a lot of worthy charities, and this of course being one of them. Do you have any sense of how much you would raise yet, or are you still sort of in the planning stages?
We're still working on that. We're just going live this month with the tournament, but we're hoping to sell out and to sell all of our sponsorships and to have a great turnout.
Because that's 2 full courses, right? You're doing 144 and 144?
Yeah, so they have 2 18s.
Oh,
so everyone's at
wonderful.
Greensmere, and and we do
Oh,
two sums.
I love that.
So it adds networking as well. So you're teamed up with another 2 some from another company.
Oh, I
so you
love
can
it.
network, support a good cause, and have a lot of fun.
Oh, that's fantastic. And have you organized a big golf tournament like this before?
This is my 3rd year being involved.
Okay.
Yeah.
So what are the big lessons learned from those other tournaments?
There's a lot of them.
Yeah.
It definitely takes a lot of work, but it's very rewarding.
Yeah.
And we sent out a questionnaire last year, just trying to improve every year and make sure everyone has a good time. And
Have you already started to talk to the weather gods about
We
that
have
day?
been,
Yeah,
yes.
exactly. Make July 11th a beautiful sunny day.
Yeah, exactly.
No, it's wonderful. And you know, we've been talking. We talked with Dr. Gail Beck earlier. We talked to a couple of volunteers. We talked to Catherine LaRue, of course, from the Distress Centre. As you've been listening to them, are you even more proud to be doing this? I mean, we heard some incredible numbers today.
I really am. And they have so many resources and so much to offer. And it's just great that we can support them and help them build that and keep going with the great work that they've been doing.
Yeah, for sure. Who else is helping you organize the tournament?
So there's 12 members on our committee. We're all volunteers. And I'm the co-chair for this year. And then my partner is Caitlin Rain from PCL. And it's the first time having an all-female lead for the OYCL. So that's also really exciting for us.
I love that. So the sector, I would assume, obviously male dominated, I'm assuming.
Yes.
So you know, from the perspective of the Distress Center and you know, that would be even just something to be reaching out to them to say, I'm in a sector that, you know, I'm finding it hard to maybe find my way. I mean, there's lots of different reasons you could call the Distress Center.
Yeah, definitely. And we learned a lot more about it today, which is nice.
Yeah,
And
which is great.
I'm really glad the word's getting out, and I think it's going to help a lot of people.
For sure. When you think about, because I just about fell off my chair, when they talked about 55,000 calls last year, I started thinking to myself, where would you even start? That's why, of course, they've got 200 volunteers, and they're staffed, obviously, and have supports 24/7. But did the 55,000 number surprise you?
It did. That's a lot of calls every day.
Yeah.
Like,
It's
it
incredible.
takes a lot of volunteers to do that, and
Yeah, it's
It's
wonderful
incredible.
to see that, and those are the kinds of things. You're probably going to do this already, but at the golf tournament, sharing those numbers, because I think when people are there and they see the impact that they're going to have, whether X amount is raised or it doesn't really matter how much is raised, we know that every single dollar is going to be put to good use.
yeah, and definitely get the word out that they need volunteers to keep this running, and
Yeah.
it'd be a lot of people to answer that many calls. So hopefully we can help get some volunteers as well.
Absolutely. So how will people learn about the golf tournament? Is it something that's within your association? If someone's listening today and they're part of a construction group, are they welcome to connect with you?
Yeah, so anyone that's a member of the Ottawa Construction Association can attend, and we'll be going live May 13th
Okay.
for sponsorship and to some sales. And anyone can reach out to us at the OYCL as well.
Yeah, that's wonderful. And your role, you mentioned it's your family's company.
Yes.
So talk to me a little bit about what that was like to be part of the family business.
It's been interesting.
Yeah.
It's a lot of fun, but I grew up in it, so I didn't really know what else to do.
Right.
But not a lot of people get to spend the day with their dad and their brother every day, right, at work. So it has its challenges, but it's really rewarding. And I grew up going through Ottawa with my dad and him showing me everything he's done. So I get to do that for my children now. And he always taught us that Ottawa has been good to us, we have to be good to them, and we have to give back to our community. It's
Wow.
very important.
And I'll tell you, I know Waterden's been a very generous organization, a very generous business in this community. And I love your dad's philosophy.
Yeah.
I think that's wonderful to be able to have that kind of commitment. And do you think your children will follow in your footsteps?
I think they will. My 3-year-old was telling me how roads were built.
Oh, perfect.
So I'm sure.
That's wonderful. Yeah, that's wonderful. And mental health. I mean, you're a mom.
Yeah.
I'm a mom. And I want to know that there's every single resource in this community to support my children.
Yeah.
And your children. I mean, I want all children to feel support in this community. Is that another reason it's important to you?
Yeah, and not everyone has the same that we have, and right now everyone has the same family and resources, and I want them to have what they need to be successful as well.
Now, you're a lot younger than me, but I've said this a few times during the show. We just didn't talk about mental health. We just didn't. If somebody took their own life, we said it was something else. I mean, that's just the reality of growing up in the 70s. People didn't share like they do now. I think the more we talk about mental health and engaging in the workplace, I mean, that wouldn't have happened in the 70s. Things have changed so much. So it's good to know that organizations like yours and the Ottawa's young construction leaders are also taking that step, because then if somebody's having an issue, they're more apt to know they're going to be accepted and welcomed and heard. How key is that?
Yeah, that's really important. Like, we talk about other medical issues, no problem. This is one that we definitely have to vocalize and make people comfortable and make sure they know that they can get help, and we have the resources that they need in Ottawa.
Yeah, beautifully said. So where are we finding out all this great information starting May 13th?
So the OCA.ca, their website, and also on all the Ottawa Construction Association and Ottawa Young Construction Leaders, LinkedIn and social media.
Your dad must be so proud of you. Yeah.
I'm sure he is.
Yeah, and your brother.
Yeah.
So is it a younger brother or an older
No,
brother?
I'm the youngest.
Okay.
I have 2 older brothers.
They must be so proud of you. That's wonderful. That's wonderful. I wish you all the best at this tournament. I think it's wonderful to be able to have this event happening July 11th for the Distress Centre Region, Distress Centre of Ottawa and Region, and have this opportunity to give back in this way. I wish you all the best for that event, and send you lots of good vibes for a good weather day as well.
Thank you so much for having me today.
And send our love to your whole team. I think it's wonderful that the young leaders are coming together. I think we need more of that.
Yeah, I agree.
Yeah, that's wonderful. Thank you so much to Melanie for joining us today, and thanks to all of our guests. We've had such an incredible opportunity to learn all about the Distress Centre of Ottawa and Region. A couple of things we heard today. They want to hear from you. So if you are having any sort of crisis, and I loved what was said earlier, I'm not going to get the quote right, but you know, if it's a crisis to you, it's a crisis to them. So it could be something that maybe is feeling, you know, that it's bothering you. Maybe it's something that's happened at work. Maybe it's something one of your children said. I know certainly as a parent, those days can be long, and raising children, the days can be long and the years are short. So reach out to the Distress Centre. And I loved what Catherine LaRue said as well from the Distress Centre. She indicated to us, listen, if you have a loved one, you can reach out and say, this is what my loved one is experiencing. So there's a hub of resources there. They're encouraging you to call. They're encouraging you to reach out. This is a wonderful resource in our community. 988 as well is a number that we all need to know. So certainly reach out if you are in crisis yourself, if you are in a situation where you think a loved one may need help. Reach out to them, of course, and if you can volunteer, maybe we've inspired you to volunteer today, I hope so, and if you can donate and put on a great event like Melanie's doing, that would be wonderful as well, but a monthly gift, an annual gift would be much appreciated. I'm Sam Laprade. It's an honor to host this show every single week and talk to you about the wonderful organizations in our community, and the fact we were talking about the Distress Centre of Ottawa and Region today is absolutely fundamental, and I am absolutely thrilled to share this message with you today. Until next time, stay with us on An Hour to Give.